And we are back on the WHHI-TV Daily News. Joel Taylor, who is the market president for Novant Health and Hilton Head Medical Center, is here. Thank you for being here today.
Absolutely, happy to do it.
Yeah, so we have kind of a lot to talk about today, and the first thing we want to talk about is kind of your commitment to the community and something that you have just donated recently.
Yes, ma'am. So very exciting. You know, Hilton Head Medical Center and Coastal Carolina Medical Center became part of Novant Health February 1st.
Yes.
And part of our focus on serving the community really is in reaching out and meeting the community's needs, not only in healthcare, but also with workforce housing.
Yes.
And so made a $1 million donation to the Coastal Community Development Corporation.
Yeah,
excellent. And it's a great organization and an opportunity to impact housing really this year. Really a quick win for everyone.
Yeah, I love that. And so, I mean, obviously, as you mentioned, that is a huge topic of conversation we've been talking about for many years is affordable housing, because we need these people to work in the medical field, but sometimes
Absolutely.
They can't afford to live here, so they're traveling distances. So with this donation, what you said this year, we're going to see something. What kinds of things are we going to see?
So the Coastal Community Development Corporation, CCDC, has already gone out and purchased 13 individual condominiums, and will purchase another 10 before the end of the year in Beaufort and Jasper Counties. To then turn back and lease to local residents that work here at below market rates. So relative to their income level, individuals will be able to apply for and receive these units for a lesser rent than they otherwise would be able to.
Yeah, that's really exciting. That's a pretty significant number of units, really.
Yes, ma'am, absolutely.
Yeah, and so how would somebody go about applying for those? Who are going to be some of the people that qualify for that?
So obviously within healthcare, very focused on making sure that healthcare workers, but it's also EMS, first responders, teachers, those that work in food and beverage. So really, as you kind of referenced, those folks that work in our community, that with the cost of housing continuing to increase, how do we attract them and keep them here? That's our focus, and we want to be part of that solution.
Yeah. And so how did you come up with the funds to be able to donate that $1 million?
So those funds are based on the earnings of our hospitals. And now as a not-for-profit, it's an opportunity to reinvest in our community, reinvest in our people. I think over time people can expect to see our hospitals change and grow, and just respond to the community's needs. Well,
not only is affordable housing a huge topic of conversation, but really medical needs and is also a huge topic of conversation. When people are moving here, they're thinking, what does the healthcare look like? And, as our population is aging, obviously we have a huge retirement population. So talk to us a little bit in the last minute and a half or so about Novant and how that is helping to shape the healthcare here in the region.
Absolutely. Well, Novant Health, based in North Carolina, but now expanding into South Carolina. A foundational premise for Novant Health is primary care. And so as soon as we became part of Novant Health, quickly announced the recruitment of 10 primary care providers into the area. So we are currently interviewing individuals. So that's kind of step one for us. It's also then expanding into Bluffton. We announced that just about 2-3 weeks ago that we will plan on a new freestanding emergency department in Bluffton. We will then also have medical office space, and then ultimately a new Bluffton Medical Center will be coming online, probably in 3 to 4 years.
Interesting. And I think it's interesting, excuse me, losing my voice, interesting that you mentioned primary care physicians, because I think that's something that people are really struggling with finding.
Yes.
Because some people are not taking patients at this time, or they've gone concierge. So talk to us about the people that you're looking to hire.
So I think it's really, what is unique about our area is concierge physicians can and will be successful here. But what we are looking to hire in the near term are those that would have a patient panel in the 2,000 to 2,500 patient range. And so we are talking to people who are just finishing medical school, to those who are looking for maybe the next step in their career. And some, you referenced the retiree community in this area. Some those primary care providers that want to give 5 or 6 more years to the profession, happy to talk with those folks as well. So really, anyone that can meet that need, we want to talk to.
Excellent. Well, Joel, thank you so much for being here today and for what you're doing in the community.
Yes,
we appreciate it.
Thank you.
And we'll be back in a moment with more, so don't go away.